Welcome all, and thank you for joining us tonight. My name is Haley Greenstone. I use she, her pronouns, and I am the Gender and Sexual Health Subcommittee lead for Doctors for America. Really excited to be leading our advocacy grand rounds for today. Before we get started, I want to take a quick minute to invite you all to officially join Doctors for America. Being a DFA member today means taking the important and simple step of selecting a membership level and paying your annual membership dues to support DFA's organizational sustainability and incredible programs like this Advocacy Grand Round series. There are 4 different levels to choose from, and a DFA team member should put the link to join in the chat. After this session, we will be sharing a recording and making all materials available. A few quick ground rules for the session tonight. First of all, there's no such thing as a stupid question. We welcome questions. Speaking of questions, please use the Q&A feature. We will address these towards the end of the session tonight. And look out for comments in the chat as well. DFA staff will be sharing helpful links and are able to answer questions as well. Lastly, this is an important and necessary conversation about providing care and advocating for vulnerable and marginalized populations, so hate comments will not be tolerated. Now on to our speakers. We are thrilled to welcome Alex Sheldon. They're the executive director of GLAMA and professional researcher, strategist, and advocate with over 15 years of experience in the field of human rights, with a concentration in LGBTQ+ rights. Prior to joining GLAMA, Alex was the head of research and social impact at an LGBTQ+ startup company where they specialized in economic inclusion for LGBTQ+ people. Previously, Alex served as the deputy director of the Clinton Global Initiative at the Clinton Foundation, and they held roles at Everytown for Gun Safety, the Movement Advancement Project, and several international nonprofits. They've received an MA in International Human Rights with a concentration in Global Health Affairs from the University of Denver, a BA in Psychology from Whittier College in California, and a certificate in Nonprofit Leadership and Management from the Institute for Nonprofit Practice. They are a returned Peace Corps volunteer and currently serve on the board of directors at the Equality Federation. Our second speaker tonight is Dr. Blair Peters, MD, who is a leading expert in gender-affirming surgery, a pioneering surgeon, researcher, educator, and advocate whose influence extends across medicine, policy, and social discourse. He is an assistant professor in plastic and reconstructive surgery and urology at Oregon Health and Science University, OHSU, and serves as the surgical director of OHSU's Transgender Health Program, which is the largest multidisciplinary transgender health program in the country. Additionally, he is the fellowship director of the Advanced Gender Affirming Surgery Fellowship at OHSU and leads the National Gender Affirming Surgery Fellowship Match. Dr. Peters is also an active advocate at the intersection of healthcare, social justice, and policy through engaging with major media outlets and utilizing social media presence to further amplify education, advocacy, and the urgent fight against anti-trans rhetoric and policy. Thank you both for joining.
Thanks so much, Haley. Really happy to be here.
Yeah, hey everybody. Thanks for spending your Thursday evening with us.
So I will go ahead and jump right in. I think it's really important that as we talk about the landscape of gender-affirming care in 2025, it's really critical that people understand what exactly is gender-affirming care comprised of. So if you could just give us a brief overview and also highlight some of the differences between adults and youth.
So gender affirming care in itself is an interesting term. If we kind of boil it down to its simplest form, we're talking about some type of medical care that aligns someone's body with their gender identity. So you would notice that that doesn't necessarily just apply to transgender people. It also applies to cisgender people as well. So gender affirming care, at its truest form is very well accepted in medicine. It only has become controversial when we talk about affirming care for trans bodies. But that can really encompass anything that would include behavioral health support, medical transition like hormones, or potentially surgical intervention would kind of be the 3 big categories. When we think about sort of this delineation versus child versus adult care, think what's important to realize is affirming care doesn't necessarily have a destination. So it's really care across a lifespan. There's nothing magic that happens between sort of childhood, adolescence, adulthood, when folks get elderly, that their care needs necessarily change. So there's a lot more similarities than there are differences. Of course, there are some nuances there, but it's really, a lot of the legislation and the targeting we've seen is really, really focused on care for youth, which I'm sure we'll get into.
Yeah, I'm happy to weigh in there too, even though I'm not an MD, and oftentimes I'm mistaken for one given my role. But it is as the executive director of GLAMA, and we are the oldest and largest association of LGBTQ plus and allied health professionals. So we are a huge network of folks who simply want to use their expertise, their health expertise, in order to drive change that will hopefully lead to LGBTQ plus health equity. And so I'm not an MD, and so I love to leave all the clinical recommendations and things to the experts. But it is an honor that I'm able, through my role, to be able to really channel all of that amazing expertise into big advocacy wins. So what I like to point to when we ask about the difference between youth care and adult care is that the vast majority of political attacks are on trans care are aimed at youth, and that's under the guise that it's supposedly protecting children, but we all know that that isn't true. So that difference is really, as Dr. Peters mentions, it's really not as big of a huge demarcation as most people think. But the reality is these attacks are really just part of a coordinated, very well resourced attack on trans and non-binary people overall. If lawmakers truly cared about protecting children, right now they would be focusing on addressing real issues that impact youth well-being, like expanding access to mental health services or addressing childhood poverty, or maybe preventing school shootings and preventing gun violence generally, rather than singling out and harming an already very vulnerable population. The reality is that trans young people, like all young people, they have the best opportunity to thrive when they are supported and can get the health care that they need when they need it. And parents and families and not the government know what is best for their children.
Thank you both. That is such a good point. And I think, as you both touched on, the current political landscape is very tenuous regarding gender affirming care currently. So, how has your ability to provide or support the provision of gender affirming care changed in light of the current political landscape? I know it's been particularly volatile in the past couple of months, but even before that, over the past few years, there have been increasing anti-trans legislative pushes, and that is largely focused on healthcare.
Yeah. Sorry, I'm gonna forgot I had my little cap on there. Um, so I think this issue's really been like overly made into black and white, as in like blue state, red state, as in like affected, not affected, which is not actually accurate. We are all profoundly affected, regardless of the state that we are in. Um, I think people don't really comprehend the level of violence that providers in this space have been exposed to over really sustained periods of time. So we're talking like we haven't seen anything like this in medicine since like abortion in the 1970s. Like this isn't just social media hate comments and emails, it's phone calls to your clinic, it's active death threats, it's police investigations. Like it's hugely, hugely impactful. And it's not just a me thing. It is like a very much a lot of my colleagues thing that have shouldered that for a really long period of time. And that is something that doesn't get looked at a lot when we talk about the impacts of legislation. Obviously, we're, first and foremost being patient centered, but I've always been very opinionated that being patient centered is being provider centered, because if the providers aren't safe to provide the care, then the care goes away. So I think that is something that has been sort of under advocated for really at program, institutional, and state levels, is making sure that the providers are really safe and protected to provide this care. And, speaking from someone who obviously is in this really large program, and I have, a lot of partners and colleagues that I am, worried about their safety and their like emotional and mental well-being. Certainly the new administration, and in particular the executive order that came out in January 28th, really had language that was really centered around attacking providers, trying to prosecute providers, and really fracture physician-patient relationships. And it really scared a lot of us. People are scared for themselves, for their families. Mm, And we're already talking about, care that can be intense to provide in certain moments and can be really resource intensive. And not only is what's happening destabilizing the patients and making the care more challenging by patients are obviously coming in under distress, like rightfully so, but the providers themselves are also in that targeted line of fire. So I think just the emotional mental load couldn't really be it can't be stressed enough how challenging that's been. And I think that is the greatest task that those of us in this space have over the next 4 years, is finding ways that we can maintain that care, but keep ourselves and our patients healthy. So that's my long answer to your short question.
Yeah, again, and since I'm not an MD, I can speak on behalf of our membership and the providers that I've had a chance to connect with in this current political environment. But what we do know is that 27 states have in some way restricted access to gender affirming care, and in doing so have restricted providers' ability to provide that care, meaning that they are not able to fulfill their own ethical and professional duties. They are restricted from doing so. And we at Glamour, we have sued 3 different state governments over their gender affirming care bans on behalf of our members. And that is because they are no longer able to do their jobs. And that is taking away their fundamental freedom. And then, of course, on top of that, as Dr. Peters mentioned, it's not simply whether or not you were in a red state or a blue state. Now, the federal administration, the Trump administration, has taken this to the federal level, that this is affecting providers nationwide. With the executive order that was issued earlier this year, that was really just outrageously titled, that it was aiming to restrict gender affirming care for young people under the age of 19, under this outrageous title that it was protecting children from surgical and chemical mutilation. It was just an outrageous way to title this. But since that executive order came down, I've had the chance to connect with dozens and dozens and hundreds of health professionals from all over the country about their experiences, because the second that executive order came down, many hospitals erred on the side of caution and fear, and they decided to cease care right away, even though that executive order is not law, it is not policy, it is a wish list from the president and a wish list from his administration. We did challenge that in federal court, and we were granted a preliminary injunction, and that meant that most of those hospitals and clinics and health systems that had ceased care have now returned to providing that care. But the result is absolute chaos. Many hospitals shut down care in secret, meaning they didn't formalize any policy. They were telling providers to cancel appointments over the phone and telling them not to even give any explanation for the cancellation. I have heard horrific examples of nurses, in fact, who have said that they've canceled a patient who was waiting 3 months for an appointment, wasn't able to give an explanation, only to hear, well, if my child dies by suicide because of this, it's your fault. And that is a story I've heard many, many times. Because what is happening right now, because of these really ridiculous political attacks on gender affirming care, is that providers are forced into these untenable situations. They can either continue to provide care for their trans and non-binary young people in their patient population. They can continue to provide care, but by doing so, they would be criminalized for it, and they could lose their livelihoods, even though they are abiding by clinical standards of care and actually all of their medical education and research, and all their professional experience. But therefore, they could lose their license for doing so, and in some places, they could even deal with other legal repercussions and be criminalized further, or they can abide by these ridiculous laws, and in doing so, abandon their patients who they have an ethical duty to protect. So it is just a really just impossible ethical dilemmas that that providers are being put in right now. And when we talk about the overall healthcare system in this country, that is really quite frankly, like in terrible disarray. We have a looming physician shortage, a looming nursing shortage. Like, this is a very scary prospect if we're trying to get people into these professions, but they're being told, okay, well, you can learn all you want in med school, but eventually the federal administration is just going to tell you that none of that is worthwhile. You're going to have to abide by what we believe is right in the medical field. I think that is not a really, I think, alluring way to get people into these professions. And it's also not a great way to get people to stay. So we're working really hard to create pathways for continuity of care, but also to support health professionals as they're navigating these really complex legal situations.
Wanted to just sort of piggyback on something Dr. Sheldon said that was eloquent, but particularly for providers in blue states that have state legislation protecting access to care, the providers really are in like a totally impossible situation where there is genuine fear that you are at risk of federal prosecution, and your institution and even your state may not be able to even firmly tell you that they can actually protect you against that in a meaningful way. Uh, but the state legislation you're practicing in has legislation that you would be subject to potentially discrimination lawsuits. And the degree of moral injury that I think a lot of us have incurred, where I'm very fortunate where I'm at an institution where our executive leadership has included our trans health program in the decision making. I have a lot of colleagues in leadership positions who were just told by their hospital what was happening. You can continue or you can't continue without them being involved in that at all. And then because you as the providers are the face of the program, you're who the patients know, you're the one that gets the attack, frankly, sometimes from the distress of patients and their families, where it's not even a decision you're making. And I have colleagues who have been through absolute hell, for lack of a better word, to hold this care open in states for 4 or 5, especially the last 4 or 5 years, who then the community they've given up so much to help are then now threatening to sue them because of the state legislation. And I think the executive order has been cleverly written, where there's so many ways that there can be legal challenges, but I truly think that the upfront goal is to try to fracture provider-physician relationships to drive providers out of this space. Um, so I constantly stress, and there needs to be education and bi-directional, that the providers need to be supported to continue this care, and we have to find a way to maintain those therapeutic alliances. That's our only way forward through this.
There are so many very clear and very harmful effects of the many political attacks that are occurring at the federal level through both legislation and through these executive orders, as well as in various states, as you both touched on. And we are now in this third month of a new administration that really is seeking to erase any recognition of the queer community, let alone any care. So what are you anticipating, and what have you kind of seen to be the most crucial battles to be engaging in the advocacy space? And what efforts are you involved in that are seeking to address those?
Yeah, I can start with this one. I think that this is a very, very crucial legislative and advocacy like a political battle at the moment. As I mentioned, more than half the states in this country have passed restrictions on this care, and also the federal government has it in its crosshairs as well. And what we know is, as Dr. Peters mentioned here, that this is an attempt to erode the trust between patients and providers, but it's even a step further than that. The real goal is to have us lose trust in healthcare generally, and then institutions of expertise generally. We know that they're really backing a blatant and brazen disregard for science, and that won't end with trans health care. It doesn't end with abortion care. It will end when the people who are seeking to grab power in this country have as much power as possible, because we no longer listen to anyone with any expertise. So efforts to restrict gender affirming care are just part of this much broader campaign, much broader campaign to undermine evidence-based medicine and interfere generally with our trust, eroding this trust in healthcare institutions. And so it's really crucial for all of us. And this is something that we take very seriously at GLAMA, and we use a lot of our capacity to be fighting for, is to protect medical integrity and the fundamental principle that healthcare decisions should be guided by science and patient needs, not political ideology. So that's like a really overarching piece of the battle that's at hand right now, because protecting gender affirming care reinforces the broader fight against government overreach into medical practice. And we hope that it can set a really crucial precedent for defending things like reproductive health care, vaccine safety, access to HIV treatment and prevention, and other really essential services that are under threat right now. And in terms of the other, like, really, I think, distinct or acute political battles that are underway in this administration, we know that there are attempts to roll back non-discrimination in healthcare more broadly, stripping the Affordable Care Act of Section 1557, which includes non-discrimination protections. Those are things that also protect the general population from things like being discriminated against for pre-existing conditions. Like, there are a lot of things at stake here. And then also censoring medical education is another major threat. But one of the biggest things that we have our eyes on right now is undeniably the surge of cuts to NIH-funded research. Hundreds of grants have been rescinded. That is millions of dollars that have been lost simply because the subject matter of that research were LGBTQ plus people, were trans and non-binary health, was infectious diseases like HIV and also STIs. DEI, diversity, equity, and inclusion, is no longer like any studies that even mention anything to do with any of these topics. Those grants have been rescinded. And the impact of that is so far reaching and could be absolutely catastrophic, because insights from minority populations and insights that stretch from everything from like bone health to like maternal safety, those increase knowledge that affects literally everyone. And cutting grants is going to slow down scientific discovery for everyone. And also, young researchers are going to lose their jobs. So the field as a whole is going to suffer. It's essentially a loss of a whole generation of science and a whole generation of researchers. But what I find like most egregious in this space particularly, or most hypocritical, is that the people who oppose gender affirming care usually rest their arguments on this supposed lack of research or lack of evidence. But now they're stripping away all the funding that makes all of that research and evidence gathering possible. So if you're looking for proof that the real goal in this very hostile political climate is simply to erase the trans and non-binary population, just look no further than the fact that they're saying you can't have healthcare because there's no evidence, and you can't study this to get more evidence because your population doesn't exist, or your population is not in the interest of the broader population. So we're really watching that very, very closely, and hoping to be able to support a lot of the researchers in that space, and also be able to support some of the providers that benefit from some of that research. And the last piece I'll touch on like a big political battle here is cutting out the public from regulatory processes. RFK Jr. has announced that he intends to fully redo the regulatory process that governs how government agencies make changes to their policies and procedures. And normally there's a comment period for the public, and he is seeking to strip that out entirely. That's a place where GLAMA actually really mobilizes our health professionals to weigh in on regulatory things like telehealth, or how different drugs are scheduled. All of these things end up being a part of like regulatory processes that eventually now we're just going to have, it's going to go into a black box, and we will have no idea what is informing these decisions because comments will no longer be allowed from the public. It's a scary dystopian reality. Sorry, that was a lot of battles at one time, but there's a lot going on right now.
There is a lot going on right now. I'll give you an example of what Dr. Sheldon said about sort of this whole idea of low quality research or low quality evidence. What's important to realize is the systems that they're running our body of evidence and studies through are things like the grade system, where anything that isn't a randomized controlled trial or an extremely large prospective study with control groups is going to be deemed low quality. So if you think about that from the practicality of trans health, that would mean randomizing patients to healthcare or no healthcare, which is never going to be approved through a research body. So it's actually impossible research to even do. So I think it's important to understand that the quality of research we have is actually pretty good in keeping with like most other areas of medicine. So a lot of, things like antidepressants, radiation therapy, a lot of these like pillars of medical care also would not pass that same standard that's being applied to gender care. But they're also now taking away, really the major path forward to try to be able to chip away at that low quality evidence research narrative. The point about, gender care also bettering healthcare for all people is very true. I can give you sort of a powerful example from my own practice. I'm trained in peripheral nerve surgery. I do genital surgery 2 to 3 days a week. After doing hundreds and hundreds of affirming genital operations, I've learned a lot of nuances of genital nerve anatomy from the perspective of a peripheral nerve surgeon who would not typically be operating on genitals, and have adapted a lot of what I've figured out doing affirming surgery for trans patients to actually treat and cure chronic pelvic pain and chronic genital pain and restore lost sensation for a lot of cisgender patients with issues that they have seen physicians for 15, 20 years and that have been totally uncorrectable problems. And those are techniques that I have learned on trans bodies that I'm now using on cisgender people who are traveling across the country for those surgeries. That's just one small example. So, healthcare for one population truly is better healthcare for everybody in the long run. And I think it's hard to really suss out. Sure, there's like different magnitudes of battles, but um, everything kind of matters. So, even right now, there's like an open public commentary period on a rule that was issued by HHS and CMS talking about essential health benefits. And gender affirming care, where there's only a small number of states where that would necessarily apply to. But the important part is all of this just extends the permissibility structure to drop gender affirming care under insurance. And what I can tell you from the provider perspective, where I'm in a very, very protected state, we have seen an increasing number of Medicaid, even denials, Medicare denials for gender treatment. I had 3 surgeries last month that the hospital is not reimbursed for. That is not normal. So even though we're protected right now legislatively, there really is this sort of empowerment with the social political atmosphere by a lot of these sort of administrative bodies to start trying to deny things. So it's important to fight the battles that we can, even at our local regional levels, because they do truly all add up.
Absolutely. I think it can be really overwhelming to look at how much we're being inundated currently with these constant different attacks in this political landscape at all these different levels. And I think it's really important that we also recognize advocacy for gender and sexual minorities has been a longstanding reality. Um, so, how has your approach changed with, I think, this most recent past couple of months, or even in the past couple of years, if at all? How has your approach changed?
Yeah, I think so. Glamour has a really rich legacy of impact, and often people think of our organization. People who haven't heard of our organization might think that we're a little bit newer. But Glamour has been around since the early '80s, and we were actually founded by LGBTQ plus physicians who were watching the onset of what would become the HIV and AIDS epidemic, and they were watching their friends and loved ones die while the government completely ignored the reality of this public health crisis. And so they knew, based on their lived experience and their health expertise, that they could be making a change, and that's how GLAMO was founded. So we have a rich legacy of bringing together this unique experience, this unique expertise, and driving change as a result. In fact, some of like the earliest, I saw really early mentions of modes of transmission of HIV in our earliest newsletters that were like printed, like like handwritten and then like typed up on a typewriter and like sent out. It was wild. Like there's really wild ways that this was like not a typewriter. It was the 80s, so not necessarily a typewriter, but like it was like really done in this like really incredible community driven way. And we've been able to take that legacy and that's what we're doing now in the face of government erasure, in the face of a hostile political environment where we're still utilizing the strength of our membership to drive change in research and education and advocacy. One of the key ways that GLAMA has shifted, particularly in the light of this political is that we've expanded our legal advocacy into state level advocacy. We've been a power player in the federal space for quite a while, but most of these attacks were happening at the state level for a long time before the Trump administration. So we shifted and we're really trying to build power at a local level and really bringing together physicians in specific places as well as other health professionals in states that were where this care was under attack and where the LGBTQ plus healthcare was under attack in order to use like local expertise to drive that change. And as I mentioned earlier, we sued the state governments in Texas, Missouri, and North Carolina over their gender affirming care bans, and we were able to bring in our members from those states to provide like their own testimony in these legal battles to say how their work was affected, how their patients were affected by these bans. And it's really powerful when you're sitting in a courtroom and you're hearing from someone who like lives down the street from you, as opposed to someone who might live, a few states away. So we shifted a lot of our work to the state level and building that sort of local power. The other way that we've shifted, especially in light of the Trump administration, is to focus, well, I would say to invest even more in healthcare training and health education for healthcare professionals. We know that educating health professionals in LGBTQ plus health is more important than ever. And so we've invested in on-demand access for CME that's specific to LGBTQ plus and BIPOC health. So when you join member, which everybody should definitely do, you get access to our really gigantic repository of CME credits, over hundreds of hours of credits. Is very specific to LGBTQ plus and BIPOC cultural competency, relevant for all different health professions. And we doubled down investment into our annual conference. This year, we are hosting our third annual conference on LGBTQ plus health, and that will be in Minneapolis, Minnesota, in October 9th through 11th. Again, go to glamma.org and you can find out more about the conference. But it is a fully accredited conference for all health professionals, and we have like dozens of hours of CME and CE credits that are available, and you can learn. It's the premier event for LGBTQ plus, a premier scientific event for LGBTQ plus health. And so we really want to make sure that we don't lose access to that sort of education that is going to drive real health benefits for LGBTQ plus patients. And that is something that is really crucial and could potentially be lost with all of these attacks at the moment.
I think as far as advocacy goes, I think people assume that means political, as in, testifying and being involved in legislative efforts. And obviously that's one channel. But there's a lot of different ways that somebody can advocate. I'm sort of someone that I think has given more or less weight to different forms of advocacy, depending on, I think, what the moment is. Through this, the priority number one for me, I am fortunate or have been fortunate to be able to coordinate a nationwide fellowship match for graduating surgical residents to match to fellowship programs to formally train in gender affirming surgery. So I had to self-fund my fellowship. For context, not that long ago, there were not formal treatment pathways available. And it's really only in the last sort of decade that we've had formal training pathways where people are actually getting hands-on education. And our fellows are graduating and starting entirely new programs in university systems. My last fellow is building a program at Stanford. The one I'm training now is going to Minnesota, which was just mentioned. So that is the most important thing that I'm doing right now, because that is taking that knowledge and expertise and it is allowing it to blossom and flourish in other states where care is not at the level that it needs to be. So I think really leaning into what your skill set is, but I think people also picture advocacy needing to happen at this like prolific level to be meaningful. which isn't true. In queer culture, we always like talk about this concept of our houses. And I always sort of like to tell people like your house is your own responsibility. So the most important thing that you can do is have conversations with people that you have close relationships with who respect you. So that may be family members, that may be friends, that may be close work colleagues. Um, but you are more likely to make an impact than what they're going to see or hear from people that they like care less about. So I think being willing to step beyond your comfort zone, that's usually when advocacy starts becoming effective, and sort of pushing through that little bit of resistance to have to kind of have tough conversations is probably like the most important piece of advice I could give. The one thing I've leaned away from, um, it was sort of touched on here, I think loosely, but we're in a time where expertise doesn't matter anymore. Facts don't matter anymore. Science doesn't matter anymore. So I will not engage in debates about like the existence of trans people and like the effectiveness of healthcare, because you can't have a meaningful discussion if it can't be based in reality. So there is no point wasting our time and energy like getting trapped in those battles. And I think that energy is better put towards whether it's institutional, state level, or challenging legislation, but not engaging in this sort of like open social discourse that's happening.
Absolutely. I think it's very important to recognize that advocacy can and should include political advocacy, but it can also take many other forms. You've both touched on a lot of really important efforts around ensuring the education of trainees and physicians in LGBTQ plus care. And there's a lot of uncertainty about job prospects and the field at large currently. What advice do you have for medical students and trainees who are engaged in advocacy and seeking to potentially provide gender affirming care or at least support the field?
I would say medical schools have been very ahead of residency programs, fellowship programs, hospitals, and certainly divisions and departments at, I'd say, sort of really effective DEI initiatives where our medical school classes look very different now than they did even 10 years ago. So the queer representation, especially the trans representation, has massively improved. And just I think the generation in medical school right now just wants people overall to just have their rights in healthcare. So the interest in even my type of work with gender affirming surgery is totally overwhelming. There are like more medical students than I could like ever possibly mentor. So the interest is there. I think in a lot of ways that's what gives me hope is regardless of what's happening politically, everyone in medicine right now is this wave of, it's not being a wave, it's like a tsunami of change that is coming because that is the next generation of healthcare providers. And this isn't debated. Like this is just accepted. Their issue is there's not enough of this integrated into their curriculum. That's their biggest problem is, hey, like, why is everyone making this controversial? Like, we just need to be learning about this stuff. So I find that overwhelmingly very positive. I think at the end of the day, you need to make your career choices and decisions based off of what you're passionate about, no matter what you do in medicine. It's a tough gig. Like being in medicine is a hard job. And what's going to keep you going is truly feeling connected to the work that will kind of keep the passion and sort of backfill your energy. But providing care for marginalized communities does not limit you to one marginalized community. I have a skill set that I can apply to hundreds and thousands of reconstructive problems. You're always going to be adaptable. You're always going to be able to find a job. And the reality is, if you provide some meaningful care and especially representation, you may not see a job that necessarily looks like what you want it to be, but I promise you the patients are all there. And as soon as you can be on your own with some independence and autonomy and say, hey, this is what I'm doing, here's who I am, people are going to find you really quickly. So um, you don't necessarily need to see it to be it. Because if you're out there existing, I promise you there's a lot of people that need the care that you're wanting to provide. So just try to keep that in mind through what is ultimately a very hierarchical, sort of stringent, rigid system that doesn't exactly encourage thinking or doing something differently.
Yeah, I couldn't agree more with that answer. And also, my advice that I give to medical students and trainees and residents is to get involved early. Join advocacy groups, speak up in medical schools, and make sure that you're advocating for your own training and your own voice. I love to tell folks to get involved with health professional associations like Doctors for America, like GLAMA, like the AMA, the AFP, and literally all of the other acronyms under the sun. Um, we at GLAMA, we are the only LGBTQ plus organization with a voting seat in the American Medical Association's House of Delegates, and so we are able to promote LGBTQ plus inclusive policies within the AMA through those positions. So I've seen really like firsthand how that sort of policy is crafted in that delegation. And I've also then seen firsthand how the student and resident sections are shifting. They're really changing the tide in those powerful, powerful arenas. So just know and really believe that you can use your voice for change. Health professionals are still among the most trusted voices in this country, despite all of the attacks on your legitimacy. Nurses are incredibly well trusted. Physicians are incredibly well trusted. And if you are able to hone your health expertise voice and your own unique voice, you can become an incredible catalyst for change. I would also encourage folks to develop your policy chops. A lot of folks think that health professionals only focus on the individual, but I know so many health professionals who are so incredibly dedicated to making structural change. And it's really I think it's incumbent on these folks who are in those positions to make sure that you are aware of the ways in which policy is created and the ways in which you can weigh in. Serving as an expert witness in court and legal battles, providing legal testimony in legislative battles, or writing op-eds or talking to the media. And again, as always, talking to people across the dinner table. All of those ways are things that all of those are things that you can do to make sure that you are changing people's minds and also making change in the policy world. But one crucial piece too is when you're getting involved in these organizations, what I always remind people, and I'm glad that someone told me when I was coming up in the policy world, is that relationship building within these organizations is the most crucial piece. Definitely, figure out how laws are made, watch how a bill gets made into a law, all of those things. Watch the Schoolhouse Rocks amazing videos and educate yourself in those ways, but know that the vast majority of change is made person to person. And these are people who you will meet and you will probably know for decades and be working alongside. So it really just takes knowing like one person that can actually change how someone sees the entire world. I'm fairly positive that I'm like the token non-binary friend or acquaintance to probably dozens of people. And I like revel in that because I know that when there are attacks on trans and non-binary people, that there are some people that it wouldn't have even crossed their mind to even think twice about, but they might picture me or picture my friends, and they might actually change. It might actually change how they interpret what is happening. So I really encourage everyone who is in this space, use your credibility as future physicians, as physicians, to push for institutional change and really use that to resist the I don't know, like all of the political ideology that is overtaking and subjugating evidence in when we're creating medical policy.
Thank you both for those answers. It is very encouraging to see um, how much passion and investment you both have in ensuring the longevity of gender affirming care. I want to touch on a couple of the questions in the chat. I've seen this one a couple times, but a couple of people have asked, you're both doing a lot of very important work. It can get really heavy. How are you maintaining your well-being and preserving your own sanity in this space? What does that look like when you're engaged in such heavy and difficult spaces?
Oh gosh. I feel like there's two buckets for me. Of course, there's coping mechanisms and then there's self-care. One of my favorite coping mechanisms is definitely reality TV. That is definitely something that's continuing to bring me joy and distract me from the reality of what's happening in our communities. In terms of self-care, like leaning on my community has been incredibly important. As I said, like relationship building to drive political change is one thing, but it also is what sustains us in these fights. I rely on my friends and my work colleagues so much, and just really cultivating any chance for joy in this environment is just the weight is just immeasurable. Like it's so important in this space. So and then also really like from an organizational standpoint, we are relying more and more on our partner organizations. The zone is flooded right now. We, as an organization, we cannot respond to everything. So the way that we are making sure that we don't burn out is by being in constant communication with all of our allied organizations at all times. So when something horrific happens, and unfortunately that is like every hour on the hour in this administration. And so we are not responding to everything. But when we don't, it is because there are 3 or 4 of our partner organizations who are responding. And then those organizations, when something is coming up and they don't have capacity, it's us who responds. So it's really about being as coordinated and as connected as possible, because what this administration wants and what the conservative, what our opposition wants is to divide us as much as possible, to burn us out, to really to stretch us all so that we are unable to respond, and that we are unable to keep going. And the only antidote for that is to continue to be as connected and to be as supported as possible, and to allow some people to step up and step back when needed.
Yeah, I'm sure everybody's heard some of the kind of phrases of like joy being resistance and rest as a form of resistance. And those are obviously very true to a point, but they are only effective if you are truly finding respite and truly getting rest, which does mean boundaries have to be ever increasingly strong. I'm someone that's fortunate to um, have a position of authority, I guess, now, and certainly have sort of made a name in different academic circles, and I get called on to speak to a lot of things. I operate 4 or 5 days a week and run a practice and fellowship and do research and all these things. And like, you cannot be everything to everybody and be everywhere all at once. So it's really just radically and unapologetically saying no to things that you don't have the time or bandwidth for. I think I also accepted when we're in this especially current era and things are changing so rapidly, and there's so many things coming at you, you're likely going to make some mistakes. You're probably going to have some misfires. Hindsight's always 2020. I kind of took a just radically relinquishing myself of any guilt or shame for something I did or did not do in the moment, depending on what my capacity was. Because if you are truly, doom scrolling, looking at every possible update, and I am acting on every possible thing that comes at me to make a difference, I don't think I'd be having this conversation with you right now. I would have been in the ground years ago. So I think you have to accept that you are one person and building relationships is important. And that to me was the big change of I don't have to be like the only surgeon and only person in a leadership position of one of these programs that is engaged in the media and engaged in policy and engaged in advocacy work. And I've focused more on actually bringing others into that work, and getting them engaged with it. So I also can take a bit of a step back and have sustainability long term.
It's so important to make sure that you can stay in this work in the long run. So thank you both for doing all that you do and ensuring that you can continue in this space as well. Um, want to just get to a couple more questions, and then I know we're coming up on the end of this session. Um, so I think one of the questions that has come up is kind of how would you suggest, based on current experiences, addressing anti-trans, anti-LGBTQ stances, um, whether it's within your own communities, among older physicians, with lawmakers. How do you kind of find the most success?
Yeah, this is such a common question. It's such a good one. And I've worked in the advocacy space as my far too long bio at the beginning alluded to. It's a really complicated question, and it sometimes just comes down to the right like messaging frames. The most effective method that we have found in order to like kind of cross that divide, I know feels like it's getting further. It's just growing and growing and growing, and people are getting further and further away from each other. But this is not the first time that our country has felt this divided. Like we felt this divided over the Vietnam War. We felt this divided over many other things in our history, and there is a possibility for all of us to come back together around central, like very, very core belief systems here. So when you're talking to an individual or even speaking to a larger group, the best way to connect with someone is one, to avoid kind of casting them in any sort of like negative light. If they have these sort of beliefs, not calling them any sort of name that would shut them down, because that is what gets triggered is often like a fight or flight in someone when they're in these conversations. So the very first step is to not, call someone transphobic simply because they don't understand what it means to be trans or non-binary. That's a great way to just shut someone down and turn on all of their defense mechanisms. The way to build that bridge is by connecting on shared values. So when I talk to someone who is maybe doesn't really understand what's going on with gender affirming care for youth, the first thing I say is, it sounds like you really care about protecting young people, and you really care about the health and well-being and safety of young people. I do too. And that is how we start that conversation. And that is a really important connection point. You want to situate it instead of two people who are facing each other with animosity. You want to come over and be side by side with them and be guiding them into this conversation. Then the next step is sometimes useful, is called like a journey story. So sometimes we say things like, you know what, I actually didn't know any trans people a few years ago, and I really didn't understand what gender affirming care was then. But you know what? Then I met my friend so and so, and then I went and I saw this documentary. And you know what? It really changed my mind. You should look at like this is a great opportunity for learning. And there's ways that you can really like guide someone on a way to change their mind. But right now, that just isn't happening in modern political discourse. It is really just a lot of people shouting into their own echo chambers, or really getting angry at each other, or honestly like fighting AI bots and comments online. Like it's just a really fraught area, but there are a lot of steps you can take. And one of them is simply just connecting on shared values. Freedom is a great shared value. Protecting and like help and advocating for children's well-being and safety, another great value. Those are things that you can connect with to kind of start the conversation from a place where you're on the same side and not adversaries.
Yeah, I found I wrote a thread that went sort of mini viral earlier this week, just based on a lot of conversations I've had with different patients over especially the last few weeks. So I do not just perform gender affirming surgery. I'm a plastic and reconstructive surgeon. So I cover trauma call and hand injuries and all of these things for the state. So I see and get sent a lot of patients from conservative areas who are 100% Trump voters and have mega hats on. And I'm sure some of them have probably said things about me online, etc. But I'll put their fingers back on, or replant their arm, or save their hand, or whatever it is. Um, and it's been fascinating to see in those moments, like how quickly that ideology goes away when they themselves need care and access to healthcare and are struggling. And it's sort of been powerful to see if you can form a genuine connection, or just a human connection with somebody in front of you, how many of those views have changed over the course of my clinic and the post-operative course. Because my whole clinic is set up for gender patients, right? Like that stuff's everywhere. I have a lot of visibility. It's every other patient on my list that day is, a trans patient. And I think just that degree of visibility and sort of seeing that, oh, I have this impression of this person based off of like what Fox News has said or whatever online, but this person's just like here caring for people that need help. And I think that's sort of been a powerful thing to shift people's opinions. So I kind of agree with the points of not engaging or sort of attacking people and putting up more barriers. We really have to create space that people can step into. And if we're not creating that space, there's literally nowhere for them to go other than further away from you. So I think we need to keep that in mind. Like, I will never bring that up and sort of challenge that patient explicitly. I will just sort of be there, silently supporting them. And 95% of the time, they will initiate that conversation before their care is done. That's obviously with physician-patient relationships, but a lot of people on this call probably have those. So just something to kind of keep in mind.
I think we have time just for one more question. So if you could summarize a couple of action steps for our audience, what would you hope they take away from this talk in terms of um, opportunities to advocate for gender affirming care?
I'll try to be quick. I think I said earlier, be willing to have one-on-one conversations with people that are close in your life and respect you. Number two, make sure that you know who your local trans advocacy organization is. And if they have a mailing list, get on it. That's going to be your best way to understand opportunities to, put in a written testimony or testify in person or show up when you need to show up or get your institution involved. So make sure that you're staying informed in your area that really matters to you. Um, and then I think last but not least, never underestimate, even if you're very junior in a system, the change that you can create, especially medical students. You wield a lot of power in your institutions and hospitals. It may not feel like it, but especially if you can collectively band together, I've seen people do some pretty amazing things. So reach out to a faculty that's like-minded that can kind of help and support at a more senior level, but don't underestimate the change that you can make.
Yeah, that's a spot on answer. And if you're not aware or you're not already connected with or don't know where to find your local LGBTQ plus or trans advocacy group, there are organizations in every single state. There are two great websites to go to, or two great organizations that serve as umbrella organizations. One is Equality Federation. I do happen to be on the board, so I am a little biased, but I do love them. But they are the umbrella organization over all LGBTQ plus advocacy organizations, from One Colorado to Equality California to Equality Florida. So if you, any of those states, or any state throughout the country, you can find your advocacy group through Equality Federation. And then also on a more local level, there are hundreds, like 500 or so LGBTQ plus community centers all throughout the country who are also involved in advocacy work. If you go to centerlink.org, that is the umbrella organization over all of them. And that means that you can find your local LGBTQ plus community center and get plugged in with their advocacy efforts there. And then the third thing, again, a little bit biased here, but get plugged in with GLAMA. We send state specific, city specific, and national advocacy and action alerts all of the time. And so please sign up as a member, sign up for our mailing list, and you can receive that information so you can plug in. But it'll also give you opportunities for training so that you can become a better advocate, and also resources and research that goes out to all of our members and our mailing lists so you can be educated in these spaces so that you can use your expertise to the best of your abilities.
Thank you both for your time tonight and your expertise in this space. We're so grateful that we could host this. I will make sure to send out to the attendees a list of these action steps as well. And just before people leave, education is important, and so is action. So please get involved. We would love to have you join DFA. We also mentioned a number of great organizations to get plugged in with, GLAMA, of course, as well as finding your local organizations. And then there's a lot of other opportunities, as we heard tonight, writing op-eds or letters to the editor. We have advocacy alerts through DFA, really just connecting with your network, doing institutional advocacy and making sure to advocate for the patients right in your community. There's so many opportunities. Please watch for additional opportunities through DFA. And for those who are paid sustaining members of DFA, please complete the survey for a credit of CME for attending the session. In addition, if you enjoyed this advocacy grand round session, please continue supporting DFA's work and impact. The link to donate will be put in the chat. Thank you all for being here and for all you do on behalf of patients. We hope that you will become an official DFA member today and take a look at the opportunities to get involved in the benefits of membership. The number one reason that doctors, medical students, and health advocates join DFA is to be with like-minded people that share the same values and priorities. Once again, thank you so much to both Alex and Blair for their time tonight. This was such an incredible event, and I am so grateful to have gotten to hear from you both tonight on gender affirming care and advocacy in this space. Thank you.